In 2015, I had a fracture on my tibia plateau, so I went to see several orthopedic surgeons, and they recommended a total knee replacement, which I was totally against because my husband had had a total knee replacement that has been revised 3 times. I decided to come to the Arthritis Relief Center, and it's been a life changer for me.
So what can you do when knee pain shuts you down? Our next guest has a way for you to get back up and moving pain-free and without surgery. Dr. Zara Huda is a pain management physician with Arthritis Relief Centers. Good morning.
Good morning, Deborah. Thank you so much for having me today.
Absolutely. Well, when it comes to pain, we certainly know some of the go-tos have been pain medications or surgery, but there is another way I want to talk about in just a second. But first, you decided to go into this type of medicine because you watched your mom deal with pain.
Yeah, growing up, my mom was diagnosed with rheumatoid arthritis when I was around 9 years old. So I've been in and out of doctors' offices and hospitals seeing her suffer with joint pain. So I knew I wanted to grow up and help others who suffered with joint pain as well. So that's why I'm lucky enough to help others at Arthritis Relief Centers.
Yeah, my mom had arthritis. I watched that growing up as well. So Arthritis Relief Centers, you treat people with joint and spine pain. You specialize in FDA-approved treatments for osteoarthritis of the knee. We certainly know that what has increased, like 375% really is those knee operations, but not necessary.
Yeah. So a lot of times patients are recommended for knee replacement surgery, but they may not know that they're excellent candidates for our non-surgical pain relief treatments. So we provide these FDA-approved gels or hyaluronic acid knee injections to help patients that are suffering with knee osteoarthritis. And a lot of times these injections can be life-changing, and they see a significant improvement in their daily life.
Yeah. Okay. So what's happening oftentimes in our knees that causes things to break down, and how does that gel replace what we're missing?
Yeah. So what happens is that when you have joint pain, the most common cause is arthritis, which is inflammation of the joints. But the most common type of arthritis is osteoarthritis, which is the wear and tear of your cartilage inside your joint. So when the cartilage thins, it's similar to the rubber on a tire thinning after chronic use. So when that happens, you get pain and it limits your activities. So in a normal joint, you have a cartilage inside your joint that secretes this lubrication. When you don't have that, you can have symptoms of osteoarthritis like pain, stiffness, swelling, loss of flexibility, cracking, instability, and weakness. And when you don't have that lubrication in your joint, that's when you get the significant pain. We add that gel using a fluoroscopic guidance through a low-dose X-ray every time we do the injection to ensure that it's in the correct spot in the joint to provide maximum relief. Now, a lot of times patients may feel, they may go somewhere and they get this injection, but it's done by feel, just by palpation. We're different in that we use an X-ray every single time, so we ensure that patients get the best results.
Yeah. How often would you get this injection?
So it can be a series injection. It could be once a week for 3 weeks, 4 weeks, or 5 weeks. It really depends on what brand is best for the patient. And we determine that by taking a full history, physical exam, and doing X-rays, and going through that with the patients in depth and finding what brand and which gel is best for them.
Yeah. Another question a lot of people have is, okay, I'm sold, I'm in, willing to try anything, and this sounds great because it's not the pain medication and it's not the surgery. Is it covered by insurance?
Yeah, so because this is an FDA-approved treatment, it's supported by medical research, it is covered by most insurance companies like Blue Cross Blue Shield, United Healthcare, Cigna, Aetna, Humana, and of course Medicare plans as well.
Yeah, all right, so who should consider this?
Yeah, so patients who are recommended for knee replacement surgery, or even those who aren't ready for surgery at this time. They may need it in the future, but they are working and they don't have time for the rehab right now, or those who are not medically cleared for surgery, and even those with mild to moderate osteoarthritis who don't want their knees further worsening. These are the people who should be encouraged to try these non-surgical pain treatments because it could really help them and it could save them the surgery.
Yeah, that makes sense. Like so many different issues, if you get to it early, then it's easier to deal with.
Exactly. So I do encourage my patients, if they start having knee pain at an early age, whether if they've been really active when they're younger, or if they've had like meniscal injuries or ACL injuries in the past, which makes them prone to having osteoarthritis at an earlier age. Those are also patients who could really get some benefit.
Yeah, you have the Bel Air and the Clear Lake location. You have another location coming soon?
Yes, we have a brand new location in Katy, which is on South Fry Road and Kingsland Boulevard. That's opening just next month. So really excited about that.
Yeah, all right. We're living longer. We're just wearing out some of our body parts. It's nice to know that you all can help us keep up. Thank you so much.
Sure. Thank you so much for having me.
Arthritis Relief Centers has a special offer for Great Day Houston viewers. Now through April, you can get a free, no obligation screening when you mention Great Day Houston. To schedule an appointment, call this number. It's 281-609-6377, 281-609-6377, or visit them online at arthritisrelieftx.com.